Good morning. My name is Kevin Garner. I am a medical doctor. I'm a fellow of the American College of Physicians and a member of the Illinois State Medical Society, both organizations that strongly oppose assisted suicide. I'm also board certified in internal medicine. I'm board certified in hospice and palliative medicine and also in addiction medicine. I serve as a medical director at a federally qualified health center. I'm a part-time hospitalist, and I also do inpatient hospice consultations on the most difficult to control end-of-life cases. Before I start, I'd like to clarify a term. The word suicide has been bandied about and muddied and blurred by those promoting this bill. Webster's dictionary says suicide is the act or instance of ending one's own life voluntarily and intentionally. The euphemism promoted in Senate Bill 9 does not change the fact that participants would be voluntarily killing themselves and thus committing suicide. It only changes the legal ramifications of that act. So this bill assumes that doctors can accurately predict death within 6 months, and that's simply not true. That's a lie. I've personally cared for hospice patients who met Medicare criteria and lived for over 1 year. One who was on hospice intermittently for 4 years survived that long before passing. My own father lived 2 years while being cared for continuously by hospice. Even when utilizing the gold standard palliative performance score, cutoff of 40 to predict a 6-month survival, the accuracy is only 50% in predicting who's going to die in 6 months. Also, this legislation assumes a quick and peaceful death. However, although massive doses of legal drugs are given to patients with the promise of a serene death, in reality, reports from Oregon indicate the dying process may require several hours. During that time, patients may struggle to breathe, they may vomit, they can hallucinate, and they can have seizures. In the latest Oregon report from 2023, 10 out of 102 patients for whom data was available experienced serious complications, and those included choking, vomiting, and seizures. In 265 cases, the reporting was inadequate. Thus, in the 367 total cases, the reporting was casually omitted over 70% of the time. There's our safeguards. There's our watch over what might happen. And then, again, as was stated earlier, although many cite uncontrolled pain as a compelling reason for passing Senate Bill 9, data from Oregon indicate that pain isn't even in the top 5 reasons, as was just stated. The most frequent reasons, again, were loss of autonomy, not being able to participate in fun activities of life, loss of dignity, loss of control of bodily functions, and being a burden to family. Pain, or the fear of pain, combined in the Oregon data, only came in at 34%. But again, we don't know how many of these patients actually had pain, because for some reason they decided to combine the two. Maybe a third of the patients had pain, maybe a fourth, maybe a tenth. We don't know because of their reporting. Any of these reasons are not adequate justification for ending one's life. These are issues that require supportive care and treatment, not suicide. Because over 90% of the patients I treat in my office suffer from mental illness, I am extremely concerned that Senate Bill 9 does not mandate that a person requesting assisted suicide be referred for mental health evaluation. Most people commit suicide due to depression, which is extremely common but very treatable in both the terminally ill population as well as in the general population. Depression and existential issues such as hopelessness and loneliness can influence the wish to die and are commonly missed by busy doctors. During 2023, less than 1%, that's under 1% of patients in Oregon who requested assisted suicide were referred for psychiatric evaluation. The prevalence of severe depression in the U.S. population is around 8%. So you can see that 7% difference alone implies multiple lives that were needlessly ended. As a hospice doctor, I'm concerned that Senate Bill 9 ignores symptoms including pain, depression, and anxiety that can be controlled by proper palliative intervention. And again, hospice is more than just drugs. It includes visits by doctors, nurse practitioners, and nurses, but it also includes home health aides to relieve caregiver burden, social workers to assist obtaining necessary resources, counselors to address mental health issues, and chaplains to address spiritual health. Hospice can help patients find deeper meaning in their prior experiences and purpose in their current situation. It can provide closure for families prior to the loved one's death and grief counseling afterwards. Senate Bill 9 legitimizes and promotes suicide instead of endorsing suicide prevention. It's easy for the right to die to morph into the duty to die, and this discriminates against those requiring the most intense and expensive care: the terminally ill, the elderly, the chronically ill, the mentally ill, the addicted, and the disabled. I believe that the role of the physician is to affirm the lives of our patients, to relieve suffering, and to give compassionate, competent care as long as our patients live. Assisted suicide would usher in abuse, discrimination, and injustice. Rather than hastening patients' death, we should improve the quality of their lives by advocating for increased access to mental health professionals, palliative care, and hospice services. Finally, the American Medical Association Code of Ethics prohibits physicians from actively ending a life. They state, and I quote, euthanasia is fundamentally incompatible with the physician's role as a healer. It would be difficult or impossible to control. Legislators, please pay attention. It would be difficult or impossible to control or regulate. Difficult or impossible. This is the AMA. And it would pose serious societal risks. Some have the hubris to dismiss those, quote, serious societal risks as a so-called slippery slope. It's not a slippery slope, it's a cliff. And if Senate Bill 9 becomes law, we jump off that cliff. Don't turn doctors into killers. Thank you.